Hey there, this is Hadley and Tracy, and we are going to present to you Advances in Health Education and Promotion from 2000 to present day. While the concept of health education and promotion had been gaining traction and becoming formalized over the course of the 20th century, it was the beginning of the 21st century that fully cemented the profession not just as recognizable, credible role, but one that was necessary for the health of our nation. Advances in this field in the first 10 years of the century allowed for standardization among institutions and certifying organizations, as well as a call to action at the federal level. Healthy People is a government publication released every 10 years detailing health objectives for the nation. In 2000, Healthy People 2010 was released, this time with a focus not just on setting health objectives, but as it subtly stated, understanding and improving health. This document showed the nation's shift in health and wellness away from being a strictly medical model but a broader lifestyle model, a result of behaviors, choices, and the environment rather than just the presence of disease or infection. Healthy People 2010 identified 10 primary indicators of health that would be the focus for the next 10 years. These are listed above. These indicators are a clear representation of the nation's understanding that health can be affected and even improved through changes in lifestyle, behaviors, and the environment. Healthy People 2010 was an important reference tool for health educators and promoters at multiple levels, federal, state, and local, to plan effective health education interventions. The nation's focus on health education and behavior continues and is reflected in our current initiative, Healthy People 2020, where one of the overarching goals is promote quality of life, healthy development, and healthy behaviors across all life stages. The development of a code of ethics for health educators began as early as the 1970s. However, it was not until the year 2000 that a complete and agreed upon ethics code was established. This was a result of efforts from national health education organizations such as Society of Public Health Education and the National Commission for Health Education Credentialing. This code of ethics provides an agreed upon standard among these organizations and health educators to which all in the industry can be held accountable. It also is a tool for health educators to guide ethical health education practices and decision making. By providing health education to youth in a school setting, students are encouraged and empowered to develop and participate in healthy behaviors and increase their overall wellness while diminishing their risk for disease and injury. In 2006, the second edition of the National Health Education Standards was released, which emphasized health literacy in students as an important tool in increasing and maintaining their overall health. In 2008, the National Board Certified Health Education Teacher provided growth and development opportunities for qualified school teachers. 2008 also saw a milestone in the professionalism of the health education practice outside of school settings when the Certified Health Education Specialist and Master Certified Health Education Specialist exams received formal accreditation. Although the National Commission for Health Education Credentialing has been offering the CHES exams and designation since 1989, there had not previously been a formal accreditation for this designation. This was a clear barrier to have the CHES curriculum and skill set universally accepted among schools and institutions preparing students for a role in the field. Receiving accreditation allows for standardization among the learning, development, and expectations of professionals preparing for and receiving these certifications. As the first decade of the 21st century drew to a close, health education and promotion became more accessible to Americans due to the Patient Protection and Affordable Care Act instituted by President Obama in 2010. Historically, health education is most accessible to those with financial means, yet the population that is in most need of these services is the poor. The Affordable Care Act allowed for an additional 31 million Americans to receive health care coverage and, by extension, of health education services. This provided new opportunities to health educators with the ability and responsibility to reach an exponentially larger population and to design and develop educational programs to meet the needs of these Americans. From the years 2000 to today, as the needs of quality health education and promotion are further recognized, the role of the health educator has evolved to become better defined as well as valued. Documents and certifications have helped to standardize the practice of health education to ensure that programs are developed and promoted in ways that follow best practices. Finally, the developments of this decade also allowed for the expansion of health education opportunities to greater populations in public, healthcare, and school settings. Thank you for listening.